Today, let us take a look at the treatment and management of autism spectrum disorder. Autism, as many of you know, is a lifelong neurodevelopmental condition. It's characterized by a unique way of experiencing the world, which can include challenges in social communication and the presence of repetitive behaviors or intense interests. As we look ahead to 2026, it feels like we've reached a major turning point. The traditional approach, which often focused on broad behavioral management, is now evolving. We're moving towards a new era of precision psychopharmacology, where treatments are tailored to the individual's specific biological needs. This shift couldn't come at a more crucial time. With the prevalence of autism now estimated at 1 in 36 children, the demand for effective, personalized care has never been more urgent. To understand where we're going, it's important to understand where we've been. Longitudinal research studies that follow people over many years paints a clear picture. Adolescents and adults with SD are a highly and increasingly medicated population. One significant study that followed individuals over several years found a striking statistic. By early adulthood, a staggering 81% were taking at least one psychotropic medication. And once a medication regimen begins, there's a high likelihood that it will continue long-term. This isn't just about a single prescription either. There's a significant trend toward what's known as polypharmacy. This is where individuals are prescribed multiple classes of psychotropic drugs at the same time. The goal is to manage the complex web of co-occurring conditions that often accompany autism, but it also highlights the immense challenges families and clinicians face in finding the right support. So, what are the current standards of care? You might be surprised to learn that, as of now, the FDA has only approved 2 medications specifically for symptoms related to ASD. These are risperidone and aripiprazole. Both are antipsychotics, and they are indicated strictly for managing severe irritability. This includes behaviors like aggression, self-injury, and intense, unmanageable tantrums that can pose a risk to the individual or others. However, the reality of medical care for autism extends far beyond these 2 drugs. The vast majority of medication management involves treating co-occurring conditions using off-label prescriptions. This means doctors are using medications approved for other conditions to help with symptoms that are common in autism. For instance, managing ADHD, which is very common in autistic individuals, often involves stimulants like methylphenidate or non-stimulant alpha agonists. Anxiety and depression are also frequently treated with specialized protocols, often using SSRIs. And then there's sleep. Chronic sleep disturbances affect up to 80% of children on the spectrum, creating a massive challenge for the whole family. Addressing these sleep issues is a critical part of a comprehensive care plan, often requiring a combination of behavioral strategies and, sometimes, medication. But the landscape is changing rapidly. A landmark development in late 2025 gave us a glimpse into the future of precision medicine. The FDA approved leucovorin calcium for a specific subset of the autistic population who have cerebral folate deficiency. This was a huge step because for the first time, a medication was approved that directly addresses an underlying metabolic root cause of some autistic features, rather than just managing behavioral symptoms. It was a proof of concept that targeting biology works. Looking ahead into 2026, the pipeline is filled with unprecedented progress, especially in a long-sought-after area: treatments for core social deficits. One of the most promising candidates is a drug called L179. It's a tyrosine hydroxylase inhibitor, and it's moving toward late-stage phase 3 trials. Why the excitement? Early results showed what researchers called meaningful improvements in socialization skills for teenagers and young adults. In fact, the improvements were nearly double the threshold required to be considered a success. This is a potential game-changer, offering hope for a treatment that could directly enhance social connection and communication. And that's not all. In December 2025, a presidential executive order reclassified cannabis to a Schedule III substance. This move has been a catalyst, significantly accelerating research into botanical-derived drugs. 2 such candidates, AJA001 and SCI-210, are now advancing through phase 2 trials. These are being developed as potentially safer, more targeted alternatives for managing the same kind of severe irritability that risperidone and aripiprazole are used for. The hope is that they can provide the same benefits with fewer side effects, offering more options for families. So what's the science driving all these new developments? Much of it is built on a theory known as the excitation-inhibition imbalance hypothesis, or the EZI imbalance. This theory is a leading model for understanding the neurobiology of autism. It suggests that in the autistic brain, there's a delicate balance that's been tipped. Specifically, research points to reduced levels of GABA, which is the brain's primary inhibitory neurotransmitter. Think of GABA as the brain's brakes. It helps to calm neural activity and filter out excess sensory information. When you have less GABA, the brain's accelerator, glutamate, can become overactive. This EI imbalance is thought to contribute to many classic features of autism, including sensory hypersensitivities, difficulties with social processing, and even seizures. With this biological target in mind, the next challenge is identifying this imbalance as early as possible. This is where artificial intelligence comes in. Scientists are now leveraging AI-driven neuroimaging to get an earlier and more accurate picture of brain development. In groundbreaking new research, deep learning algorithms are being trained to analyze EEG data, that's the electrical activity of the brain. These algorithms can detect subtle patterns that are predictive of an ASD diagnosis in infants as young as 9 to 12 months old. This is incredible because it offers a vital window for intervention long before clear behavioral symptoms fully manifest. Early diagnosis can lead to early support, which we know is crucial for long-term outcomes. Of course, with any new medication, safety is the top priority. The clinical community is united in its emphasis on a start low and go slow approach. This is especially important for individuals with ASD, who may have altered sensitivities to drugs and metabolize them differently. Starting with the lowest possible dose and increasing it very gradually helps to minimize potential side effects and find the sweet spot where the medication is effective without being overwhelming. This is particularly true for antipsychotics, which carry known risks like weight gain and metabolic changes. Because of this, regular and rigorous monitoring is non-negotiable. This includes tracking body mass index, or BMI, checking blood sugar and lipid levels, and screening for involuntary movements, a potential side effect known as tardive dyskinesia. It's also essential to remember that medication is never a magic bullet. Experts across the board agree that medication is most effective when it's used as a complement to, not a replacement for, behavioral and educational therapies like applied behavior analysis, speech therapy, and occupational therapy. The best way to think about it is that medication can help lower the behavioral noise, that overwhelming anxiety, irritability, or hyperactivity that can get in the way of learning. By calming the system, medication can create a state where an individual is better able to engage with and benefit from therapy, allowing them to focus on developing crucial communication and life skills. So what is the ultimate goal of all these medical advancements? It is a point that cannot be stressed enough. The goal is not to change who an individual is. It's not about curing autism or erasing the unique personality and strengths that come with it. Instead, the goal is to reduce the disabling barriers and challenges that prevent an individual from engaging with the world, learning, forming relationships, and reaching their full potential. It's about improving quality of life, increasing independence, and giving autistic individuals the tools they need to thrive on their own terms. With the powerful integration of AI for early diagnosis, the development of new core symptom modulators, and an unwavering commitment to rigorous safety standards, the future of autism care is becoming more hopeful, more precise, and as wonderfully individualized as the spectrum itself. Thank you so much for watching.